Hi, I'm Dr. Jim Hoven of Ramos Law and your host for Health Matters. Today, we're going to explore what physical therapy is, what physical therapists do, and how they work to make sure that your trauma injury heals as safely, quickly, and effectively as possible. Have you ever been asked to go to a physical therapist? Has your medical doctor, chiropractor, some other provider that you've been with said, hey, you need to go get some PT? And you're like, why would I get to go PT? I can do exercises at home. Well, there's a couple reasons for that. One is the research shows that most people, after having been experienced or having been exposed to an injury, they've been in a car accident, slip and fall, postural traumas, even micro traumas at work, whether it's like typing all the time and they get some kind of overuse syndrome in their arms or hands or wrists or whatever, they need physical therapy. But unfortunately, when you give someone exercises to do at home, they usually don't do them. Now, the other risk of that is that they don't do them correctly. So you get shown exercise one time and you're like, oh yeah, I got it. And you go home and you're thinking, I don't know if I got it. So you try to do the movement, but the problem is if you do some of these movement patterns incorrectly, you actually can risk damaging the muscle, the tendon, or the joint even more than it was before. So that's why PTs play a critical role in getting someone who's been involved in an accident or who has a musculoskeletal injury back on their feet correctly, quickly, and effectively. So let's talk about PTs. PTs have physical therapists, there's actually a degree you can get now, a DPT, which is a doctorate in physical therapy. So these are the highest level, highest trained people. It doesn't mean that the best PTs all have their DPT, but it just shows you the level of expertise that this group of providers goes through in order to do a great job for you. Now, what they're trained to do is to evaluate and assess all the joints of the body. And in particular, what's going on with the balance between the muscles and the joints, strength and flexibility, power and accuracy. So they look at all of these aspects of a person's body. Now, it might be if you just have a shoulder injury that they might just look at the shoulder. But you'll find other physical therapists who will not only look at the shoulder if you have a shoulder injury, but they'll also look at the back. How is the pelvis moving? Because if you have a pelvis that's stuck and not moving in the right way, then when you go to do movements with your shoulder, there's going to be an impact coming all the way down from this part of the back here. We won't go into the specific mechanics of that right now, but just to know different PTs look at things different ways. But overall, they're going to look and see, is the strength of your muscle right? So they'll put you through exercises, they'll put you through stretches, they'll put you through motion tests, and they see, are you strong enough to do the things that you're supposed to do without limitation? Then they're going to check flexibility. Do you have good range of motion in your joints? They're going to check how tight the muscles are. And if the muscles are too tight, they have ways to relax them. And some of that is manual therapy using their hands. Others is different sorts of machines. So electrical stim machines, heat machines, those kinds of things. And they can even work with other movement type of therapy. They might use tape, kinesiology tape. They might also have you do something with different kinds of stretches. So they're working with muscles. But they're also working with exercises. PTs are great at knowing just the right exercise to help rehab an injured body part. There are different exercises for the neck than there are for the shoulder. There are different exercises for the knee than there are for the lower back. So these group of providers, they're trained specifically to know, do I want to work on the deep intrinsic muscles of the shoulder, or do I want to work on the big movers? Do I want to really check out the inside muscles of the knee, or do I need to check the hip flexors, the hip movers? And so by them adjusting their plan based on what you have, they can get right down to that effect of working on the muscles to relax them and then working on the exercises to help get you strong. Now, they typically work in conjunction with chiropractors, medical doctors, acupuncturists, and massage therapists to really get the full effect, but they are really, really experts at making sure that the exercises and the flexibility, strength and flexibility and endurance, that the muscle can do what you're asking it to do for a good period of time. Now, the reason that they do all this is so that they isolate you in exercise movements so that you can then go out and translate that into your movements of everyday life. So what you have to do at work, what you have to do at home, what you have to do in your social activities, what you like to do for your hobbies, all of those things, that's what the object of physical therapy is to do, to get you back to doing those pain-free, fully functioning, just like you could before the accident. That's the basic of what physical therapy does and what PTs do. If you have any questions on that, there's lots of types of physical therapists out there. Make sure that you meet with them in person, ask them what their philosophy is, ask them what their treatment plan would be, and that you'll get a sense of whether there's a good vibe for you to connect with that person or not. But of course, as always, if you have questions, please reach out to me. It's jim@ramoslaw.com, and I'll help you in any way that I can. Until next time, remember, your health matters.